Hi guys, so I am out of surgery. It's the next day, and I've had a little bit of time to recover. And I wanted to just kind of walk you through the last part of the process for those of you who are wondering, and those of you who may be contemplating surgery yourself. So, one of the things that was a little bit scary about my particular surgery is that there were basically three things that could happen. Number one was that I could go in, plan A was that they would be able to scoop out all of the breast tissue and the cancer, and then the plastic surgeon would be able to come in right behind my doctor and put in implants. And so I should wake up with, new breasts and not feel like too much of is missing of me. And then the second option was that if the blood flow wasn't quite good, or if the skin wasn't responding well, then they put these kind of flat implants in, and what happens is they sew them in while you heal, and as your body is healing, then they stick a needle in every week and blow them up so that they get bigger. And then the last option, of course, is that nothing is responding well, and so you wake up and your chest is flat and you just have some hanging skin, and you have to let that heal. And wear prosthetic bras and things like that until after the surgery. So those were the risks in also doing a mastectomy. Part of the risks anyway. But what they did is I came to the hospital bright and early, 6 a.m. to get checked in, and started to meet some of the nurses and anesthesiologist and the nurse anesthetist. And they keep you talking, and you keep things light, and you just sort of talk about whatever the day brings you, talk about your families. And then as they wheel me back to the holding space, my Bobby was there with me, and the anesthetist came in to obviously start an IV on me. Now the problem is that the cancer and where they're going to take some lymph nodes from me are on this right side, and my right side is actually, it's my dominant arm, and so it's the easiest side to draw blood from. I have a really good vein there, but because they're going to do so much work on that side, they don't want to put it in on that end. So then we have to go to my left, and my left is not quite as strong. So they actually ended up putting it in my wrist. Kudos to that guy, because he had to fish around for a little bit, but it got in there. As you can see, they taped it down really good to make sure that I would have all of this in here to have my IV drip and all that good stuff. And then here's the cord for where the IVs and different things where medications have been inserted. They give you a little fall wrist bracelet so people know, and then there's another little bracelet you wear to identify yourself, and they ask you your name and your birthday lots and lots of times. So once we were in there, I got to talk to both doctors. My first surgeon, she was the one taking care of the actual taking out the breast tissue and taking out the cancer. The interesting part is that, like I said, a lot of people had to come together to make this happen. During the surgery, they also put what's called a Foley, or many of you know it as a catheter, inside so that you don't, pee during surgery. And this, after the surgery, can take some time for your body to readjust so that you can pee again. And kind of a good sign of healing is that you pee. So anyway, as no sooner do I get wheeled into surgery, do I doze off, and the next thing you know, 6 hours later, I'm waking up from surgery, and was very pleased to look down and find that I actually woke up with breasts. So first things first, I was super, super ultra grateful. And just to give you guys a PG peek, the plastic surgeon, she puts this this is like a clear, almost like a skin, over where the wounds and stuff are, where she's done surgery, so that it's waterproof. And there you go. Look, I have tatas, and they're actually. I asked her to make them a little bit smaller than the ones that I had before, because all my life I've actually had really large breasts. And would like to wear shirts that I don't have to ask my mom to sew the buttons down the front for me, for lack of not trying to knock someone's eyeball out with a flying button. So these are a little bit swollen right now, so they will go down a little bit more, but they're even, and I'm excited. I knew that she must have done a really good job, because my first nurse was bringing in other nurses to like come have a look and just talking about what a good job they did. So I'm excited to let them do their thing over time. And one of the things I read online was that sometimes women get the implants and they don't feel like they're part of them. But it doesn't feel that much different to me. I still feel like I have breasts on my chest. Just the healing part, a little bit sore. It just feels like I've been doing a lot of chest exercises, and especially over in the left is where I felt it the most. But for the most part, the pain's been very manageable. Coming out of surgery and recovery, I actually didn't really take any of the pain. She was asking me what my pain level was. I was like, a 1. She was like, a 1? And I was like, yeah, I'm good. And of course, I'm still under anesthesiology, and so if I didn't have pain, I just didn't feel the need to, add pain meds. I want my healing to go as good as possible. So without having to add more pain meds to my system, then I'm not overloading it any more than I have to. And so since I didn't need them, I didn't take them. And she was semi freaking out, but I said, I'm fine. If it hurts, I'm going to let you know. And so they finally wheeled me out of there and into my private room. It's like a little hotel room, and there's a Murphy bed, so my niece was kind enough to help me out for the night and stay here. And then they give you all kinds of cool stuff. What was really great is they assign you to a nurse that is kind of your like care manager. And mine, her name is Christy Evans, and she gave me her card. She left me a little note yesterday, because by the time I got into my room, she'd already left for the day, but I got to see her in the morning. And the reason Christy is so special to me is because she actually had her surgery done by my same plastic surgeon, and she, when she called me to also to greet me and say that she'd be hanging out with me through the whole process, she let me know that we had the same surgeon. And jokingly I said to her, can I see your boobs and can I touch them? And she says absolutely. So sure enough, when I had gone in for my pre-op, she lifts her shirt up and she lets me feel them and she lets me look at them, and they looked amazing. They actually do a thing where after surgery you don't have a lot of feeling in your breasts anymore. So when your nipples are actually, you're not going to feel anything anymore. So if you wanted to opt out of nipples altogether, you could not put them back on. But obviously, I think when you're looking at yourself in the mirror, it would be kind of an odd thing to be like, well, I'm not a Barbie doll, so so they can do 3D areola, and then the doctor creates a nipple, or they can sometimes keep your original nipples and just put them back on. So it's very interesting, the options. And I was kind of like, oh, okay, I'm not sure what I'm going to do. And hers was the 3D with the fabricated nipple, and they looked perfect. Looked really amazing. They felt good, like they weren't going to be shifty, and they did. They looked at. She's probably 10 or 15 years older than me, and they just looked fantastic. So I basically called the plastic surgeon, said I'd like mine to look something like that. Those look amazing. And so I think we accomplished that. So I'm excited to see the progress as we go along here. But anyway, Christy's really special to me, because after doing that, I just felt a million times better. A million times. Because it's one thing to go online and look at pictures and see other people's, work, but to actually see a living, breathing person that you can touch and talk to in front of you who had the same doctor really meant a lot to me. So that was probably one of my more emotional parts of this journey, strangely enough. And it was just that, that connection. So the other nice thing is the gals that in the Joan Catt Center, it's a volunteer center here, they left me this really note, and it's pretty cool. It says, congratulations, you're a breast cancer survivor, and so glad this hurdle is over with. Yay, you're in the Andrews Women's Hospital, and all the nurses here will take very good care of you. The journey to recovery is in full swing. Call us if you need anything. So I thought that was really nice to walk into my room with that little welcome note. Here in the hospital, it was fairly comfortable. It's a lot of people coming in and out, because obviously they're checking on you often. They do put in drain tubes. So what happens is, if your lymph nodes are having issues and they had to take any out, you actually end up with three lymph drainage tubes, but one for each breast. So sorry, this is kind of gross, but here's one of mine. It's like a little bulb, and it's attached to this you know tube that is attached to me, and these can come out once my drainage is below 20 cc's a day. And so right now at 30, which is great, coming out just one day, but we take these out and drain them and clean them, and it's really easy. Just kind of put it in the cup, measure it, and then put a little alcohol swabby on to clean around the area where you close it up and stick it back on. So I've got this this shirt was by the ladies in the Joan Cat Center. They gave it to me so that I would have a this is a compression bra. This is kind of another compression, but they leave it nice and light for you, so you're not overly compressed. And it sits in a pocket inside, and it velcros in. That way I can walk around with these things if I need to. But the hardest part yesterday was after surgery. I got in here and I was really thirsty, so they started me on ice chips and then let me gradually go to water. I must have had like 2 or 3 of these gigantic things of water, but I didn't need to pee. At least I didn't feel like I needed to pee, and part of that is because the anesthesia was obviously still in me doing its part. And so they want you to pee. We made an attempt at about 6:30 last night, and it was tough. I have to tell you, I was concentrating. They ran the water for me. I was imagining, trying to imagine, and what was happening is I was getting a trickle, so a little bit of a trickle, but because you can't feel anything down there, it's tough to make yourself pee, because you're sure your bladder's full, but you just don't have the feeling. And there's a slight burning sensation because, again, they had that, Foley in there, and they had to take it out, and it was in there a long time. So I tried again a few other times, and each time it's a challenge because you're hooked up to the IV, so you have to drag that in there with you on top of getting up out of the bed. So it's a little bit of a process, but later that evening I said, okay, let me try some hot water, and the hot water ended up actually not, well, it's good and bad, because hot water I felt like definitely got my system, like woken up. At that point I hadn't eaten very much. I just tried a little bite of this and that. I just wasn't feeling it. But what I did do is I had a green juice, and I had some coconut water, and then I had regular water. So by the time I got to the hot water, I actually started to feel nauseous, and then they gave me this lovely little green bag, and I'm sure you guys know what this is for. Blah. So I filled this baby up with about 16 ounces of fluid, and felt much better after that. And about an hour later, I was good to go. I could actually pee again, and then can't tell you how grateful I was just to be able to pee normally again. So as funny as that sounds, that was actually one of the more difficult things of the night. They do respiratory exercises with you because they want to make sure that hi there, that yeah.
Hello, good morning.
And I'm going to pause and come back to you guys, but I just wanted to show you, they put you on this little breathing thing to make sure that you can breathe well, and then make sure your lungs are opened up really good, and that's about it, guys. That's they bring you food. Like I said, a lot of people come in and check on you, and I'm almost out of here, but that was the journey. Thank you so much for your prayers and your love and all the comments. I really appreciate it. And for those of you that are going through this journey yourself, I wish you the very best. My best positive prayers and energy are with you. And, the master physician, he's got us all in his hands. Have a great day.